amazing when you go in and actually see how our teachers are reconnecting with our students and really pushing acceleration. Interesting today, just seeing how our teachers are assessing our students, informal diagnostics within math class or English class, just to see using our curriculum, right, Dr. McComas, and trying to find out what students are what they know and what they need to work on this year. So we're really focusing on acceleration, focusing on social emotional well-being of our staff and our students. Data literacy is very big, how we're using our data to inform our instruction and making sure teachers have on-time data, and then how we're connecting with our family members. It was big last year, the re-engagement activities that we did using some of our CARES funds for that, and continuing that to really make sure we're connecting with all family members. And so we really rely on our school leaders. Now it's in the hands of our principals and what they're doing to support each community and all their students. And so it's always a great day. It's a busy day when we bring back our students. So it's been a good opening. So I'll take any questions or comments. Yes, sir.
I'm sorry, before we begin with that, I did want to make sure that everybody knows who
Oh,
all these
yes.
folks are. And if I could also, just so everybody knows up here who you all are, please start, John, with you, and if you could just say your name and your
Yes.
affiliation real quickly.
Yes.
Sure. John Lee with WYPR.
Great.
Lillian Reed, Baltimore Sun.
Lillian Reed, okay.
Chris Papps, Oxford Times.
Yes.
Tim Tooten, Joe, Levin.
Amy Simpson, Fox 45.
Hello, Average Labor Nurse, WJC.
Wonderful.
Hey there, Dave Detling, WMAR 2 News.
Great, great. And then cabinet members?
Good afternoon, I'm Mary McComas. I'm the Chief Academic Officer. Thank you.
Good afternoon, Mike Zarchin, Chief of School Climate and Safety.
Good afternoon, Mildred Charlie Green, Acting Chief of Staff.
Good afternoon, Brian Scriven. I'm the Chief Administrative and Operations Officer.
Good afternoon, Shira Anderson, Chief Human Resources Officer.
And one more chief.
Good afternoon, Miriam Yarbrough, Chief Organizational Affairs.
Okay. Yes, sir.
We have been hearing that at Woodlawn High School there have been some concerns regarding COVID positive cases among one of the sporting teams. What do you know about that, if indeed that is correct?
So we've had some experiences when we open up in March, and we take it case by case. Athletics, of course, is a concern if we have groups of students coming together. And so right now it's going through our typical protocol just to see where we can do the contact tracing and notifying. We always work with our health officials and working with our local health officials as well as our Office of Health Services to talk about those plans. Right now, they're in the midst of looking at that situation at Woodlawn and trying its best to figure out what we can do, how we can contain, what we may do with our students and our coaches. Just unfortunately, we've had that back in the spring when we started to see some activity in the community come into the school. And again, Deb Somerville in that office and Dr. Branch and his team, we work hand in hand to determine how to best address that. Right now, that situation is being looked at this time. I don't have an outcome as to where we are at this time.
In terms of how many students may have been involved, would you know if it was indeed football and how many persons were involved?
Yeah, that's the point of the contact tracing, to see how many. And right now, I know Mike Zarchin and his team are looking at that with the health officials.
And as a follow-up, I don't want to halt the press conference or the conversation, but I mean, you had power out at Spurs Point, there was no power there. What happens in the event, whether it's a Woodlawn or any particular student that may have to be quarantined? Are they able to get virtual learning at home, even though they're not in the virtual class? How does that work?
So there's the virtual learning program. That's where we accept the students, and we actually accepted over 100 additional students this weekend based on documentation and needs. But for individual students, we work with individual schools to provide that continuity of learning. It will be, a lot of the work is there on Schoology. A lot of the work will be through a virtual platform of some sort. just knowing exactly what's going on with individual cases and planning accordingly. I will say our principals have been masterful at this. We've kind of dealt with a variety of situations, the what-ifs, working with our curriculum side and our school side as to how do we plan around that. And so based on whatever the outcome will be, we will come up with a plan. I thought you mentioned kind of the power outage. Welcome back to school. You know, those are those things that just happen that we have no control over. So sometimes we have to make some early morning decisions with some school setting if we feel we may have to close and do some kind of virtual, because in that scenario there was a power outage and we weren't quite sure when we will restore that. It's kind of like a snow day. You know, we have to make a decision based on the information that we have.
Dr. Williams, I wanted to ask about how transportation is going so far. Day 1, day 2, a statewide shortage of bus drivers.
Whew,
A week
yeah.
ago, the district needed about 65. We also received video yesterday afternoon from a parent of a student, a high schooler, with a completely overcrowded bus. So how are you all dealing with that?
Yes, you said it. It's a national issue, trying to find more bus drivers. We looked at our routes. We have over 800 routes, and we try to streamline some of the routes. I was at a bus lot early yesterday morning at 6 a.m. looking, rooting and cheering on our bus drivers because we got to encourage them and our attendants. We're still hiring and we're still adjusting. Yesterday, bus drivers had to pick up additional routes, so there may have been some delays definitely coming to school as well as dropping off and bringing students back home. And so as you recall, that was the big topic for Baltimore County my first year, actually my first month here, as we were preparing to open. Dr. Scriven and team, they had a work group to look at how we can address. For us, it's really trying to fill those vacancies. If you have vacancies and then you have call-outs, it just makes it twice as hard. And what they had to do is just pivot and look at some different routes, get folks to do multiple routes within their schedule. And so we meet as a team and discuss everything during the first week of school. We talk about, you know, what we saw in classes as we visit classes, what we saw in schools. There's always going to be something related to transportation. I talk to my colleagues across Maryland, and I'm a part of a consortium where folks from different states, and that is a phenomenon that we just can't seem to resolve, trying to fill those vacancies. Fortunately, we're working with our unions. We've been working with ASHME, looking at what we can do. I think a lot of it is around wages and benefits, and what we can do a better job in attracting and keeping our folks. And so we started some of that work with the work group under Dr. Scriven's leadership. Then the pandemic happened. We didn't have to really focus that much on transportation until we started bringing students back. But it is a struggle for a lot of our counties, especially the large counties, and we'll continue to try to explore. We need to hire more folks, to be honest, and we have to really look at our benefits and wages for them.
Superintendent, in relation to student safety, piggybacking off of the buses, the overcrowding issue, we've heard reports specifically from Chapel Hill Elementary that the first drop-off after school, not only was there overcrowding, 3 to a seat, there were also children on the floor. When WMAR first worked with the district to see what they were doing in terms of transportation, we were told that social distancing would be a priority, but this clearly shows otherwise. Can you please address student safety on the bus?
So yes, so when we hear those scenarios, the team will work with the principal and that direct supervisor to and transportation to figure out what we can do differently. In some cases, getting our students familiar with the buses and which routes and which bus to actually ride. But we do have to look at those case by cases. And that scenario, unfortunately, that, you know, as you described, a typical scenario at the beginning of the year, but to your point, the CDC guideline speaks to 3 feet as best as you can. The team at every school has worked on looking at bus routes and making sure they know and students know where they to sit and to keep those protocols and structures in place. And so I think it's just trying to problem solve and working with our transportation about how to address if there's additional overcrowding, as you described, that's happening in many of our schools. So that's kind of like the first year, or every start of the year, we have to work out some of those issues. But definitely, our principals are really working hard to minimize those situations.
Well, excuse me, in the spirit of conversation, I will also encourage you all to take advantage. We have chiefs here who are literally in charge of everything in the school system. So these are some of the experts. Dr. Williams, of course, is as well. But please take advantage of their presence here, and I would encourage our chiefs also to
jump right in. Yep.
Dr. Williams, I'm Joy with WJC.
Yep.
So we went out today and spoke with some parents to get direct questions from them for you. And one parent in particular, she has a 12th grader, and she wanted to ask you directly, how are you guys going to social distance within these classrooms?
So first, we want to encourage a 12th grader and families to remember that they're eligible for the vaccines. And so we've had many clinics out there. We have done a lot of postings out there. We've been working with our schools. We've had it at our sites, different sites throughout the county. In terms of the social distancing, we know that with our secondary schools, the pods of kids, they interact because of class changes. We're working with our health department. Dr. Zarchin, I'm going to ask you to speak a little bit about what they're doing at the schools. But we really want to push for more of our kids who are eligible to get the vaccine. You want to share a little bit of what we're doing?
Sure. So first, come up to the mic, please, because we can't hear you otherwise. So our first focus is trying to encourage students to get vaccinated. That is the number one thing we can do to protect the health of our students and staff. We have offered clinics going back to March at the state fairgrounds, where we had nurses, volunteers across BCPS working to provide opportunities for staff and then students to get the vaccine. We're proud of that effort. We have a ways to go, and we're hoping that our 11 and under students will have an opportunity to receive the vaccine as well very soon.
And we have another question about learning loss. There was another parent with a 12-year-old, and she wanted to know, how can you help the kids that are struggling already get caught up in order to be successful?
Sure, and I'm going to ask Dr. McComas to add to this. So many of our activities this summer was really focusing on that. We've had not only re-engagement activities at every school, but we had a robust summer program, whether it was virtual or in person. We also have asked our staff, we've been doing professional learning around acceleration, looking at the standards and what students need to know. So sometimes that means kind of scrubbing some of those activities that may have been very good, we liked it, but it really wasn't meeting the standard or wasn't at a rigorous point or standard within the curriculum. The state has asked all of us to give their diagnostic, so we're preparing to give the state diagnostic assessment this October, November. That might not be the data that will help us because of when the results will be available. Right now they're talking about November or December. We're going to continue with our MAP-R and MAP-M, and that gives us good data about our kids and their reading ability, math ability. And so within each curriculum, there is some kind of diagnostic for teachers, informal diagnostic for teachers to sense what students know and are able to do or what they don't know. I was just in a pre-calculus class. A teacher was giving an informal diagnostic, and she was able to determine what students knew back in the previous math class and what she really need to focus. And by having that informal data, they're able to plan accordingly as students are seated in their classroom. So it was kind of good to see it actually happening in the classroom. Dr. McComas, anything you want to add?
Yes, sir, if you don't mind. What I'll just add to complement Dr. Williams' points is schools also have access to resources to provide after-school tutoring. So that is an additional layer of support to help with learning acceleration. And I would encourage all of our parents to make sure that you get your Schoology login so that they can pay attention and see their student work as it's progressing. And of course, if they have any questions along the way, to reach out to the teacher right away. And that partnership is really going to be essential to make sure that we're helping every student move forward by keeping all eyes on learning. So thank you. Thank you, Dr.
One
Williams.
last question
Dr.
from
Williams,
Channel 2.
concerning learning loss, we know that there are setbacks in learning loss across the country. Baltimore City has already released its data publicly about the number of students that are failing from first grade to 12th grade. We have reached out to the area school systems. Project Baltimore has. We have the data from Anne Arundel County. We have the data from Carroll County. Baltimore County will not give us the data. Do you believe that parents should know about the learning loss in the county right now? And will you release that data like Baltimore City, Hartford County, and Anne Arundel County has?
So I can't speak to the other systems and what data point they're using, but as I mentioned earlier, the diagnostics that we will use, the MAP-M and MAP-R, will be for individual students and their family to know what they are able, what their reading level will be, what their mathematic level will be. We feel it should be individualized, because with that, every school can plan accordingly. I also want to mention, thank you, Dr. Boswell McComas, that we use some of our funds to extend our extended day as well as our Saturday school, just to meet some of those needs of our students. So right now, we're looking at individual students. Every school is looking at individual students to address their needs and to use our informal data to assess where students are and to plan accordingly.
But you must know the failure rate. You must know the number of students that failed last year compared
Sure.
to previous
So
years.
grades, so I don't have enough time to go into what grades look like versus assessments, but grades were presented by the state board. I know that was presented quarterly about the numbers of A's, B's, D's, and E's. And so right now, that's good. That's one data. We look at multiple data points. We look at what's happening in the classroom as well as our assessments. Our assessments, our curriculum-based assessments, deemed to be good predictors about what students know and may not know, as well as predictors for a potential what the state assessment. So we look at multiple data points, but I want to encourage our families to work with the individual teacher. We have been pushing that relationship between home and school, so families know exactly what their child is able to do, and that collaboration, communication with the teacher is going to be important this year, and years to come.
Ladies and gentlemen, we've got roughly 5 more minutes for our time together, and we do want to hear other questions, and we also want to give the other chiefs an opportunity to
that's
share their
true.
impressions of the first day. Again, this dialogue is not the end of our conversation together. It is billed as a first opportunity to hear directly from the superintendent about his impressions of the first day of school, the opening of schools. We were in schools the last couple of days, and we saw lots of wonderful things happening. So I do want to invite Dr. Williams to speak directly to that, any cabinet members who would like to speak, and I assure you, this is not our last opportunity to have a conversation. So at this time, Dr. Williams, if you'd like to
So
have
I would like to say, it's what I enjoy the most is visiting schools, and it's sitting down and actually seeing what our students are doing and what our teachers are doing, and just having the conversation. And every student that I interacted, they're happy to be back in school. They're happy to see their teachers, and they're really happy to get in some kind of routine, although we know it's not the same because of the mitigation strategies that we all have to put in place. But I just tell you, visiting schools is one of the favorite parts of my job. Yes, sir.
In relation to Middle River Middle School, this comes from a concern from a parent. She has a 6th grader. We're told that those students are not being issued lockers for the school year because of COVID, so I don't know if the superintendent or the health individual can comment on that, but yet this parent says that the children are allowed to sit next to each other during lunch. So it seems that there's...
Yeah, I can't respond to that. I believe that probably is an individual situation at Middle River, and we don't have someone from the school side to really address that. Mike, anything you want to add to that?
So the term social distancing to the greatest extent possible is one we've really worked through. So there are areas we can do that very easily, and there are areas that it's a challenge. Cafeterias, monitoring hallway flow, it can be a challenge. So I can't speak directly to that school, but that is something that we will continue to work through until the metrics really drop in a spot where we can move away from some of the protocols that we're following now. Yes?
I'm not sure if you're the correct person to ask about employee vaccinations. We were one of the districts to require this, either proof or to submit to these weekly at-home self-administered tests. How many employees did provide proof of vaccination, and how many of them are doing this weekly testing?
So we are working through that right now, developing a database where we can monitor where staff members are. One of the things that we're trying to ensure is that information is protected, and we're managing that effectively. So we're early into that, but we expect in the next few weeks to have that in place.
And will that be information made available to parents? This is something they want to know about, how many vaccinated or unvaccinated adults their children
That I can't speak to at this time. Again, we're really looking after your confidentiality and protecting that information, so I don't know that we would communicate that with parents.
Maybe
What-
a question with the young lady right here. I have a question for you, since.
Pardon me, sir, we are
No,
trying to wrap up.
I'm asking a question,
No, understood, it's about 1:29 now, so we've got 1 minute remaining, and I
Okay,
do know
I'd
that
like
this
to ask her
gentleman.
a question.
I understand, but I do know that I have this gentleman, we have this gentleman here who had a question,
I have a
please.
question about the
Yes.
mask mandate, how that went yesterday. Did you have any open defiance to the mask mandate at any of the schools from students or staff?
So I am aware of one incident where there was refusal for a mask. It was handled quickly and addressed. That was, for me, one of the great things to see as we went through schools yesterday. Students have had no problem wearing the masks and wearing them appropriately. They are so excited to be back in school with their peers, seeing their teachers again. To every school we went in, there was not a situation where students seemed reluctant. Staff members wore their masks. It was great. Just to see the students back in school in that setting learning was phenomenal. So, and that really falls into place with what we saw at the end of last year. Same thing, the students, they just want to be in school. They want to be there with their friends. They want to be there in person learning. That, to me, was the greatest part of the day yesterday, seeing folks together as a community in schools, enjoying learning, seeing each other, and starting the year the way we want to start the year. Not entirely, because we'd love to do it without the masks. We'd love not to have to worry about the social distancing, but it was a great start.
Was that a student who defined? The one person? Was that a student or staff member?
Student. Yep.
If there's a
Yeah,
positive
my-
case in
my
a
question
high
before-
school,
Sorry,
how will you guys
Go ahead,
notify?
before I was interrupted for a second. The thing is that when you, Tim brought it up and you said that this weekend you allowed other kids to come in because they had conditions. So we was getting questions from parents saying that when they didn't opt in for the virtual learning and it was cut off in July, the numbers were low, and now the numbers have creeped up close to 5 or 7. Are you allowing those parents to now reconsider to go virtual? Because the numbers are not the same that it was in June and July.
So the numbers were not low. I know we extended the deadline, and Dr. McComas, I'm going to invite you up. We extended the deadline as we saw the interest, but the push has always been in-person learning. The State Department has encouraged us in-person learning. They allowed us to expand it. We've always had some form of e-learning, but when we were monitoring the data, there wasn't, keep in mind, the number of students, we have to have the number of staff. What we were committed in doing or not doing is concurrent teaching. If you recall, back in the spring, we had a classroom teacher, you had a group of kids in the classroom and another group at home, and the teacher was trying to manage. So when we created our virtual learning program, we wanted to keep it separate. We want to have designated staff for the students. So in order to do that, we have to staff appropriately. In order to staff appropriately, we have to have the certain number, we have to know the number of students for enrollment to plan accordingly. And we offer this not only for elementary, middle, but also high school. And so what we allowed this past weekend, when we look at case by case, there were some extenuating circumstances, usually around health or medical, that we looked at and say, and with our team to say, let's allow these kids to come in. And we particularly looked at the younger ages, knowing that these students would not have access to the vaccine because of their ages. And so the numbers, when we first looked at the numbers, there were over 3,000 students who had an interest. We planned accordingly. And so as we continue to look at our program, we still have to have the staffing to teach. And we still have to monitor how many classroom teachers we're going to hire and what that student-teacher ratio will look like. And so we have a team. We have Doug Elmendorf, Dr. Elmendorf, who is the director, executive director of our program, and he is in his team. They're looking at any special requests that comes our way. But yeah, I don't know what numbers you're referring to, but we always had about 3,000 students that expressed some interest. Now, the interesting part, as I visited schools, and I'm asking, some families have changed their minds. They may have signed up for virtual learning and say, no, I want my child back with in-person. And we also seeing families enroll. As you remember, we had roughly about 3,000 students that we didn't see last year who withdrew. They went somewhere else. Now we're starting to see an increase, and our schools are busy re-enrolling students that are coming from various places into our system. So when we have these interests, we got to make sure we have the staff to meet the needs of our students. And so with the virtual learning program, we're monitoring that because we got to make sure we have the staff to meet the needs of the students.
Now we're talking about the COVID numbers going up.
Yeah. Well, as Dr. Zarchin said, we're going to look at, our goal is not to close a school. We're going to look at case by case. If there's a situation happening in one school, we're going to look at, is that a grade level? Is that a classroom? We're going to try to monitor and differentiate per school, per situation. But what we noticed last year, sometimes what's happening in the community may impact what's happening in our schools. But the whole push is to keep our schools open because many of our kids need that day-to-day in-person learning.
Dr.
If
Williams.
the
No,
student
no,
tests positive.
Thank you very much. We're going to, I did say 45 minutes, but
That's just
Dr. Williams
That's only
he's on a
10
very
minutes.
tight schedule today, so I'm going to take one more question.
If
I
the
would join
student
if you
tests
could.
positive, I think this is very important. If the
Yes.
student tests positive, can you tell us what is the protocol of notifying parents and then possibly quarantining that student so that this doesn't spread?
So our nurses have worked incredibly hard, not only the past 2 days, but preparing for this and last school year with contact tracing. So they will look at every individual case. They will identify students who have tested positive, and they would go into isolation. Students who came into contact that we don't know would go into quarantine. So that's typically a 10-day period, depending on the details of that case or cases. But our nurses have worked incredibly hard, not only to identify when students come into contact with somebody who has tested positive, but also to communicate that information with families. So a letter will go out that either says your child came into contact with somebody who's tested positive, or we are sharing this information to let you know your child did not come into contact with somebody who tested positive. Both of those letters are very important. One of the things we've tried to manage are rumors. We do not want, the talk to go out that somebody tested positive when they didn't. So we do it as timely as we can, making sure we have correct information to share with the community.
Dr. Williams, can we get one more question, please?
Chris,
Two
no, I'm
and a half
sorry,
years
Chris.
ago, you said that you were going to have an open
Chris,
and
we're talking about-
transparent administration. I just want to, can I just get one more question, please?
We're talking about the opening
I
of
know,
the
this
school
is an
year.
important question. 2.5 years ago, you said that you were going to have an open and transparent administration.
Chris, we're not going to get into that right
Two and a
now.
half years later, you've never granted Project Baltimore an interview.
Chris.
And we have reported on some pretty significant issues: sex offenders in schools, shredding of financial documents, issues with learning. Throughout all of that, why have you never granted us an interview when you promised on your first day, July 1st of 2019, that you were going to have a transparent administration?
So what I said was either I or someone on my team will be in contact to share information. And those references, those scenarios, unfortunate, happened as I started my career here in Baltimore County. And what we have done is, because they're so sensitive, we provided written statements about, here's the facts, and that's it. You know, I didn't want to go into much detail or speculation or rumors, but here's the facts. So those scenarios that you described and that unfortunately happened, some happened prior to my arrival and I had to deal with it, was we provided written statements. And that's how we managed those pretty sensitive areas that there were feelings about what the system could have done or didn't. We just stated the facts and we put it in writing.
Thank you.
You're welcome.
Dr. Williams, I'm going to give you one more opportunity to just kind of your overall view of the beginning of the school year, and thank you all very much.
So again, we're happy that we have our students back. We saw that experience back in March. Some of these questions was lessons learned, like if we had an outbreak or we had a case or what happened with the learning loss. Back in the spring, our staff has done a phenomenal job of dealing with the closing of the school year and preparing for this upcoming school year. So we want to stay positive. We want to keep our focus on our students and our staff. We have our team here. We've been looking at not only the well-being of our students, but also the well-being of our staff, because at the bottom, as we described everything else, it really falls back on our school leaders, our teachers, our classroom teachers, every educator in that building. And so we're glad that we are